Hi there, I'm Dr. Smee. I'm an internal medicine doctor, and I'm here today to demonstrate how you give insulin to your pet. We have some supplies here to show you as well that you'll need for giving the insulin injection. So for this patient, we're using this type of insulin, which is Humulin N. It's an NPH insulin. This is a human insulin that you would get from a human pharmacy. It's important to know what kind of insulin because you don't want to change insulins. It's also important because it depends on what type of syringe you use. So this is a U100 insulin. What that means is that there are 100 units per ml of insulin, and that's important because you need to use it with the right size syringe. So this is a U100 syringe. They come in different size boxes. So for patients, a lot of our veterinary patients, we recommend doing the 3/10, and that's just the smallest insulin syringe they make. So usually that's a little easier for gauging the dose on pets, which we'll show you in a minute. Just for an example, this is the different type of insulin syringe. So this is a U40 insulin. So this is used with this product called Vetsulin, which is a veterinary-based insulin. This is used as a U40, which is 40 units per ml. You'll notice the difference because this has a red cap versus the normal one that you'll use, the U100, which is an orange cap. This you would probably purchase from your veterinarian directly, so just make sure you get the right one. So for our patient, we're using the Humulin and insulin. This is going to be kept in the refrigerator to keep it from getting contaminated. It's always a good idea to write the date that you open up your insulin so you know how long you've had it for. The first time you open it, you'll also want to make sure the expiration date is good, just in case the pharmacy gave you an old batch of insulin or something like that. You'll also want to get a general idea of the consistency of the insulin. So this is a little cloudy, that's normal, but if you notice over time the consistency changes or there's clumps in the insulin, you might want to get a new bottle, so just keep an eye on what that looks like. Once you open it out of the syringe, you're going to roll it in your hands. You don't want to shake it. The rolling just helps to mix the insulin together. So once you have that, you're going to grab your insulin syringe. A lot of them will have a cap on the end that you can just pull off. So once you pull off the end of the needle, you're going to turn your bottle upside down. You're going to put it into your syringe and you're going to drop your insulin. So in some patients, so this can go all the way up to 30 units. We're just giving this patient 2 units. So it's the first 2 lines, this very couple of lines right there. So it's important because when you look, it's really hard to see that the insulin is actually in the syringe. So sometimes you have to pull up more than you need and hit the syringe if there's any air bubbles, and then you push back into the bottle whatever's extra so that you're getting just to that 2 unit mark. So that would be 5 units, 10 units, and then down the line. So once you have your insulin ready, you're gonna get it ready to give to your patient. So this patient here also has, let me see if I can turn it to the side. We have Anna helping us today. Also has a continuous glucose monitor, which we'll show a little bit more about in some additional videos. But it's nice because you can also see he has this nice shave spot. The insulin we like to give kind of in a different area over between the shoulder blades because that's where they have some nice extra skin. So it'll be really easy to see on him because he has some shaved spot there. So once we're ready to give the insulin, you're going to take the cap off the needle. You're going to pinch up on the skin, and you're going to go into the skin, and you're going to draw back on the syringe. Make sure you don't have any blood. And then if you don't, you're going to give the injection forward and come out. All right. And that's how you give your pet an insulin injection. If you have any questions or concerns that you have the right insulin or you're not sure how your pet is doing, please make sure you contact your veterinarian to get more information or more advice from your veterinary staff. All right, thank you and thanks for watching.